Good afternoon. I'm Julie Binkley from the Regents Hospital Marketing Team, and we're here today with Dr. McGonigal, who is the Director of Trauma Services for Regents Hospital. And we wanted to sit down with Dr. McGonigal today to talk a little bit about trauma. So the life of a trauma surgeon, Dr. McGonigal, must be pretty exciting and intense. Tell me about a typical day.
Sure, I think it's pretty interesting. Basically, most of my time is spent either seeing people who are already in the hospital and who are recovering from their injuries, or waiting, and it's kind of high-tech waiting for somebody else to come in via the emergency department that would activate our trauma team.
What happens when a trauma team gets activated?
Basically, we have a dozen people who are waiting for the notice that somebody's coming in, and then they run down to the emergency department, get dressed, get ready, and then they're prepared to do whatever is necessary to save someone's life when they come in through the doors.
How long does it take the team to assemble?
Usually it's less than 3 minutes, and we're almost always there before the person even arrives.
Is that patients that come in through an ambulance or a helicopter or both?
It can really be anything, and some of the people that we see actually are either walk-in or are driven in by their family members.
Wow. So about how many trauma patients do you see a year?
We see a total of about 3,000 that come into the trauma center, and about 2,000 of them end up in the hospital staying at least overnight.
And some of those are pediatric patients, right?
Yes, we see about 400 to 500 children a year as well.
Out of all the trauma patients that you see, what is the most common thing? Is it car accidents?
The most common things are falls, believe it or not, especially in older people, and then car crashes in the younger ones.
What's the strangest thing you've seen in your career?
Probably the strangest thing is someone who is actually injured by a commercial fireworks shell that fell over as it was being launched and flew into some people.
Wow, did you have to call any special teams in to help with that?
We had to be very, very careful because we weren't quite sure how much explosive powder was still left in that.
Interesting. So I think, Dr. McGonigal, that most people wonder what the difference is between a trauma surgeon like yourself and an emergency room doc who they would go see if they're having symptoms of flu or something.
Sure. An emergency doctor pretty much lives in the emergency department and sees people who come in there. I pretty much live in the rest of the hospital, but I go down to the emergency department to see people who are more seriously injured. So the emergency doctor sees anybody with any degree of early illness or injury. I see people who are hurt badly enough to need surgery or come into the hospital.
How long have you been a trauma surgeon, and what's the best thing about being a surgeon in your discipline?
Okay, I've been in the business for about 22 years, and the best thing is just seeing how, based on what we can do, people get better and walk back out the door and lead a normal life.
Well, thank you for taking time with us today, Dr. McGonigal. Hopefully we can get back with you in the future and learn more.
Thank you.